This is Chapter 1 from Timby, Nursing Foundations. Learning Objectives. 1. Name one historical event that led to the demise of nursing in England. 2. Identify 4 reforms for which Florence Nightingale is responsible. 3. Describe at least 5 ways in which U.S. training schools deviated from those established under Florence Nightingale. 4. Name 3 ways that nurses used their skills in the early history of U.S. nursing. 5. Explain how art, science, and nursing theory have been incorporated into contemporary nursing practice. 6. Discuss the evolution of definitions of nursing. 7. List 4 types of educational programs that prepare students for beginning levels of nursing practice. 8. Identify at least 5 factors that influence choice of educational nursing program. 9. State 3 reasons that support the need for continued education in nursing. 10. List examples of current trends affecting nursing and healthcare. 11. Discuss the shortage of nurses and methods to reduce this crisis. 12. Describe 4 nurses' skills that nurses use in clinical practice. Nursing origins. It's the youngest profession but the oldest art. During the Middle Ages in Europe, religious groups assumed many of the roles of nursing. Christian nuns, priests, and brothers combined their efforts to save souls with a commitment to care for the sick. Despite their zeal, they were overworked and overwhelmed. Consequently, some convents and monasteries engaged conscientious, penitent, and disadvantaged lay people to assist with the burdens of physical care. In England, the character and quality of nursing care changed dramatically when religious groups were exiled to Western Europe during the schism between King Henry VIII and the Catholic Church. The management of parochial hospitals and the ill within them fell to the state. Hospitals became poorhouses, which some characterized more accurately as pest houses. The English state recruited the hospital labor force from the ranks of criminals, widows, and orphans who repaid the crown for their meager food and shelter by tending to the unfortunate sick. Generally, nursing attendants were ignorant, uncouth, and apathetic to the needs of their charges. Without supervision, they rarely performed even minimal duties. Infections, pressure sores, and malnutrition were a testimony to their neglect. While Nightingale was providing nursing care for residents at the Institution for the Care of Sick Gentlewomen in Distressed Circumstances, England found itself allied with Turkey, France, and Sardinia in defending the Crimea, a peninsula on the north shore of the Black Sea. This is 1854 to 1856. The British military suffered terribly, and war correspondents reporting from the front lines made public the dire circumstances of the soldiers. Reports of high death rates and complications among the war casualties caused outrage among the British people. As a result, the government became the object of national criticism. It was then that Florence Nightingale offered a strategic plan to Sidney Herbert, Britain's Secretary of War and an old family friend. She proposed that the sick and injured British soldiers at Scutari, a military barracks in Turkey, would fare better if a team of women trained in nursing skills could care for them. With Herbert's approval, Nightingale selected women with reputations beyond reproach. She realized intuitively that only people with devotion and idealism could accept the discipline and hard work necessary for the looming task. To the British medical staff at Scutari, the arrival of this group of women intimated that the men were capable of providing adequate care. Jealousy and rivalry caused them to refuse any help from Nightingale and her 38 volunteers. When it became clear that the daily death rate, averaging about 60%, was not subsiding, the medical staff allowed Nightingale's nurses to work. Under her supervision, the women cleaned the filth, eliminated the vermin, and improved ventilation, nutrition, and sanitation. In sharp contrast with the military orderlies, Nightingale made rounds at night with illumination from an oil lamp, comforting and caring for the war casualties and infirm. The practice led to her public persona of the Lady with the Lamp. Nightingale and her collective recruits helped lower the death rate to 1%. Based on printed reports from war correspondents in British newspapers, word spread of Nightingale's compassion and contributions. Men serving in the military as well as their families revered Nightingale for her accomplishments. To show their appreciation, many donated funds to sustain her great work. Nightingale used this money to start the first training school for nurses at St. Thomas Hospital in England. This school became the model for others in Europe and the US. Nightingale's contributions then, she changed the negative image of nursing to a positive one. She is credited with the following: training women for future work, selecting only those with upstanding character as potential nurses, improving sanitary conditions for the sick and injured, significantly reducing the death rate of British soldiers, providing classroom education and clinical teaching, and advocating that nursing education should be lifelong. Is the following statement true or false? Florence Nightingale advocated that nursing education should be lifelong. True. To demonstrate competence and ensure the public's confidence, and to facilitate practice consistent with nursing current standards. Nursing in the U.S. In the colonial times, there were no hospitals. By the late 1700s, a few were located in larger, more populous cities like Philadelphia and New York. For the most part, itinerant physicians practiced in isolated rural settings. When requested, they traveled to provide emergency care for individuals in surrounding settlements. The initial and extended care for the sick, injured, aged, and women during childbirth often fell to female family members or kind neighbors in the community. With little more than experiential knowledge and a desire to relieve suffering, local women provided nursing care and temporarily carried out tasks such as housekeeping, laundry, and meal preparations for those entrusted to their care. Civil War nursing. The American Civil War occurred around the same time as the Nightingale Reformation. Like England, the United States found itself involved in a war without any organized, trained nursing staff to care for the sick and wounded. The military had to rely on untrained corpsmen and civilian volunteers, who were often the mothers, wives, and sisters of soldiers, who traveled with the troops from battlefield to battlefield, giving supportive but inexperienced care. Out of necessity, the Union government appointed Dorothy Lind Dix, a social worker who had proven her worth by reforming health conditions for the mentally ill, to select and organize women volunteers to care for the troops. In 1862, Dix followed Nightingale's advice and established the following selection criteria. Applicants were to be 35 to 50 years old, matronly and plain-looking, educated, neat, orderly, sober, and industrious with a serious disposition. Applicants also had to submit 2 letters of recommendation attesting to their moral character, integrity, and capacity to care for the sick. Once selected, a volunteer nurse was to dress plainly in brown, gray, or black and had to agree to serve for at least 6 months. Following the Civil War, there was an influx of immigrants into large U.S. cities with the promise of employment in the evolving wave of industrialization. The burgeoning population, however, was accompanied by overcrowding, poverty, and lack of health care. There were few, if any, family members, let alone strangers, who were available for nursing care. Because women had demonstrated their commitment and value during the Civil War, there were those who supported that women be trained to meet peacetime health care needs. In 1890, one of the first courses for training attendants for the sick was begun in New York by the Brooklyn Young Women's Christian Association. The training lasted 8 weeks to 3 months and focused on caring for chronic invalids, elderly persons, and children. It did not include any hospital experience. Later, the condensed training was extended to include home nursing skills such as household duties, hygiene, bowel regulation, bed changing, reading a thermometer, counting the pulse, and caring for bed sores. Attendants for the sick were now referred to as practical nurse attendants. Later, their title changed from attendant nurses to practical nurses. At first, the training of nurses consisted of learning the art, the ability to perform and act skillfully of nursing. Students learn this art by watching and imitating the techniques performed by other, more experienced nurses. In this way, mentors informally pass skills on to students. Contemporary nursing practice has added another dimension: science. The English word science comes from the Latin word scio, which means to know. A science, the body of language unique to a particular subject, develops from observing and studying the relationship of one phenomenon to another. By developing an accumulating body of unique scientific knowledge, it is now possible to predict which nursing interventions are most likely to produce desired outcomes, a process referred to as evidence-based practice. The word theory, opinion, belief, or view comes from a Greek word that means vision. For example, a scientist may study the relation between sunlight and plants and derive a theory of photosynthesis that explains how plants grow. Others who believe in the theorist's view may then apply the theory for their own practical use. Nursing has undergone a similar scientific review. Florence Nightingale and others have examined the relationships among humans, health, the environment, and nursing. The outcome of such analysis becomes the basis for nursing theory, which has proposed ideas about what is involved in the process called nursing. Nursing programs then adopt a theory to serve as the conceptual framework or model for their philosophy, curriculum, and most importantly, approach to clients. To clarify what nursing encompasses for the public and nurses themselves, various working definitions have been proposed. Nightingale is credited with the earliest modern definition, putting individuals in the best possible condition for nature to restore and preserve health. Other definitions have been offered by nurses who are recognized as authorities. One such authority was Virginia Henderson, 1897 to 1996. Her definition, adopted by the International Council of Nurses, broadened the description of nursing to include health promotion, not just illness care. Henderson proposed that nursing is more than carrying out medical orders. It involves a special relationship and service between the nurse and the client. According to Henderson, the nurse acts as a temporary proxy, meeting the client's health needs with knowledge and skills that neither the client nor family members can provide. In Nursing's Social Policy Statement, 3rd edition, 2010, the American Nurses Association, the ANA, defines nursing as follows: protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, advocacy in the care of individuals, families, communities, and populations. In 2010, the ANA further attests that 6 essential features characterize nursing. 1, the provision of a caring relationship that facilitates health and healing. 2, attention to the range of human experiences and responses to health and illness within the physical and social environments. 3, integration of objective data with knowledge gained from an appreciation of the client's or group's subjective experience. 4, application of scientific knowledge to the process of diagnosis and treatment through the use of judgment and critical thinking. 5, advancement of professional nursing knowledge through scholarly inquiry. And 6, influence on social and public policy to promote social justice. Based on statements from the ANA, clearly nursing has an independent area of practice in addition to traditional dependent and interdependent functions involving physicians. As the role of the nurse evolves, the definition of nursing and the scope of nursing practice will undergo further revisions. 2 basic educational options are available to those interested in a nursing career: practical or vocational nursing and registered nursing. Several types of programs prepare graduates in registered nursing. Each educational track provides the knowledge and skills for a particular entry level of practice. The following factors influence the choice of a nursing program: career goals, geographic location of schools, costs involved, length of programs, reputation and success of graduates, flexibility of course scheduling, opportunity for part-time versus full-time employment, and ease of movement into the next level of education. During World War II, many registered nurses enlisted in the military, civilian hospitals, clinics, schools, and other healthcare agencies faced an acute shortage of nurses. To fill the void, quickly, abbreviated programs in practical nursing were developed across the country to teach essential nursing skills. The goal was to prepare graduates to care for the health needs of infants, children, and adults who were mildly or chronically ill or convalescing, so that the RNs would remain stateside, could be used effectively to care for acutely ill patients. And after the war, many RNs opted for part-time employment or resigned to become full-time housewives. Thus, the need for practical nurses persisted. It became obvious that the role of practical nurses would not be temporary. Consequently, the leaders in practical nursing programs organized to form the National Association for Practical Nurse Education and Service. This group worked to standardize practical nurse education and to facilitate the licensure of graduates. The length of a practical nursing program averages from 12 to 18 months, after which graduates are qualified to take their licensing examination. Because this nursing preparatory program is the shortest, many consider it the most economical. Practical nurse programs are also considered a stepping stone to associate and baccalaureate nursing degrees. LPNs are a vital link between the RN and the unlicensed assistant personnel, that is called UAP. They work under the supervision of an RN, a physician assistant, a physician, or dentist, but their role may be expanded to include supervision of UAPs in circumstances like long-term care. Their scope of practice is described in the Nurse Practice Act and the state in which the nurse is licensed. Each state interprets the limits of practice differently. For example, in one state, an LPN may monitor and hang IV solutions, discontinue the infusion, and dress the site. The same may not be true in another state. An LPN may also delegate tasks to UAPs who may or may not have acquired state certification. The LPN, therefore, must know the extent to which nursing assistants can function and the outcomes of their actions. Because of the geographic disparities in LPN practice, educational programs, and state regulations, the National Council of State Boards of Nursing is researching and pursuing strategies to promote more consistency. Additional information on nursing practice standards for the licensed practical nurse can be obtained from the National Federation of Licensed Practical Nurses website, which NFLPN is the website. Registered nurses work under the direction of a physician or dentist in various healthcare settings ranging from preventive to acute care. They provide and coordinate client care, educate clients and the public about various health conditions, and provide advice and emotional support to clients and families. RNs care for clients who are stable but have complex health needs or who are unstable with unpredictable outcomes. RNs delegate client care to LPNs and UAPs when appropriate. Regardless of whether it is an RN delegating to an LPN or a UAP or an LPN delegating to a UAP, delegation requires adhering to the following 5 guidelines. The right task, matching the client's needs with the caregiver's skills, the right circumstance, ensuring that the situation is appropriate, the right person, knowing the unique competencies of the caregiver, right directions and communication, providing sufficient information, right supervision and evaluation, being available for assistance, validating that the task was completed, obtaining the results, and analyzing if further actions are necessary. There are 3 paths for the RN. The first is the hospital-based diploma program. This used to be the traditional route for nurses through the middle of the 20th century. Their decline became obvious in the 1970s, and the number of diploma programs continues to be lowest in relation to the other basic nursing educational programs. The reason for their decline are twofold. First, there's been a movement to increase professionalism in nursing by encouraging education in colleges and universities. And second, hospitals can no longer financially subsidize schools of nursing. Diploma nurses were and are well trained. Because of their vast clinical experience, they are often characterized as more self-confident and more easily socialized into the role requirements of a graduate nurse. A hospital-based diploma program generally lasts 3 years. Many hospital schools of nursing collaborate with nearby colleges to provide basic science and humanities. Graduates can transfer these credits if they choose to pursue associate or baccalaureate degrees later. Associate degree programs are aimed at shortening nursing education. Their originally proposed title of technical nurse, and they would not be expected to work in a management position. ADM preparation has proven extremely popular and now commands the highest enrollment among all RN programs. Despite the condensed curriculum, ADN graduates have demonstrated a high level of competence in passing the NCLEX RN. Furthermore, ADN graduates are using this level of entry into practice as a stepping stone to higher programs of learning. The number of nurses who obtained a baccalaureate degree post-licensure increased by 86% between the years of 2007 to 2011. Articulation has been difficult for some because of problems transferring credits for courses they took during their diploma or associate degree programs. Although the baccalaureate preparatory program is the longest and most expensive, graduate nurses have the greatest flexibility in qualifying for nursing positions, both staff and managerial. Nurses with a baccalaureate degree usually are preferred in areas requiring substantial independent decision making. They are more likely to be employed in hospital administrative positions, out-client care centers, public health, and home health nursing. Graduate nursing programs include master's prepared nurses, clinical specialists, nurse practitioners, administrators, and educators. A doctoral degree program conduct research, advise, administer, and instruct nurses pursuing graduate and undergraduate degrees. Continuing education is planned learning experience beyond the basic nursing program. And again, Nightingale is credited with having said, "To stand still is to move backwards." The principle that learning is a lifelong process still applies. Many states now require nurses to show a prescribed number of hours as proof of continuing education to renew their nursing license. Is the following statement true or false? The geographic location of a school does not have any implication in the choice of a nursing program. This is false. Geographic location of a school is one of the main factors that influence the selection of a nursing program. Current factors contributing to nursing shortage. Retirement rate exceeds replacement. Increased aging population requires health care. Disappointing salaries with longevity employment. Job dissatisfaction. Heavier workload and sicker clients. Publicity about mandatory overtime. Downsizing nursing staff from dwindling revenues and managed care policies. And negative stereotypes. The federal government has addressed the shortage of nurses by approving the American Recovery and Reinvestment Act in 2009. This legislation authorizes the following: loan repayment programs and scholarships for nursing students, funding for public service announcements to encourage more people to enter nursing, career ladder programs to facilitate advancement to higher levels of nursing practice, establishment of nurse retention and client safety enhancement grants, grants to incorporate gerontology into nursing curricula, loan repayment programs for nursing students who agree to teach after graduation. Rather than taking a wait-and-see position about the nursing shortage and the ramifications of the Recovery and Reinvestment Act, many nurses are proactively responding to the trends affecting their role in healthcare. Nurses are dealing with the unique challenges of the 21st century by switching from part-time to full-time positions, delaying retirement, pursuing post-licensure education, training for advanced practice roles such as nurse practitioner, nurse midwifery, to provide cost-effective healthcare in areas in which members of primary care physicians are inadequate, becoming cross-trained, able to assume non-nursing jobs depending on the census or levels of client acuity on any given day, learning more about multicultural diversity, unique characteristics of ethnic groups as it affects health beliefs and values, food preferences, language, communication, roles, and relationships, supporting legislative efforts toward national health insurance and other healthcare reforms that involve nurses and primary care, promoting wellness through home health and community-based programs, helping clients with chronic disease learn techniques for living healthier and consequently longer lives, referring clients with health problems for early treatment, a practice that requires the fewest resources and thus minimizes expenses, coordinating nursing services across healthcare settings, that is, discharge planning, which is managing transitional needs and ensuring continuity, providing older adults with a variety of nursing service such as physical assessment during periods of illness, teaching and managing medications in assisted living facilities at less cost than in nursing homes, developing and implementing clinical pathways, standardized multidisciplinary plans for a specific diagnosis or procedure, that identifies aspects of care to be performed during a designated length of stay, participating in quality assurance, which is the process of identifying and evaluating outcomes, concentrating on the knowledge and skills to manage the health needs of older Americans over age 65, whose numbers will reach 71 million by 2030. In the next 10 to 15 years, about 1/3 of the current nursing workforce will reach retirement age. Which of the following is a factor contributing to nursing shortage? A. Job dissatisfaction. B. Geographic location of schools. C. Length of programs. D. Reputation and success of graduate. The answer is job dissatisfaction. Geographic location of schools, length of programs, and reputation and success of graduates are all factors that influence the selection of a nursing program. In keeping with Nightingale's traditions, contemporary nursing practice continues to include assessment skills, caring skills, counseling skills, and comforting skills. Assessment skills acts that involve collecting data, which include interviewing, observing, and examining the client, and in some cases, the client's family. Although the client and the family are the primary sources of information, the nurse also reviews the client's medical record and talks with other healthcare providers to obtain facts. Caring skills, defined as nursing interventions that restore or maintain a person's health, may involve actions as simple as assisting with activities of daily living, ADLs, the acts that people normally do every day, for example, bathing, grooming, dressing, toileting, and eating. The nurse's role is now expanding to include the safer care of clients who require invasive or highly technical equipment. Traditionally, nurses have been providers of physical care for people unable to meet their own health needs independently, but caring also involves the concern and attachment that results from the close relationship of one human being with another. Nevertheless, the nurse ultimately wants clients to become self-reliant. The nurse who assumes too much care for clients, like a parent who contributes to tie a child's shoes and never lets them do it themselves, often delays their independence. Nurses implement counseling skills, which are